I'm Helen Cross. I'm the Prince of Wales Chair of Childhood Epilepsy at University College London, Great Ormond Street Institute of Child Health in London. I'm a paediatric neurologist who specialises specifically in complex childhood epilepsy. There's no doubt that children with hypothalamic hamartoma, and particularly those with early onset seizures, are at risk for cognitive and behaviour problems. When we look at series of children reported with hypothalamic hamartoma, or epilepsy specifically associated with hypothalamic hamartoma, there is a very high rate of cognitive and behaviour difficulty. The difficulty we have when we look at the range of behaviours particularly is it's very similar to what we see in other types of complex epilepsy or epilepsy coming for surgical treatment. And even the rate, 72% of individuals, is similar rate to that we see in other types of epilepsy. But there's no doubt there may be some very specific behaviours that are specific to the phenotype of hypothalamic hamartoma, not least rage attacks. There's also a high rate of cognitive difficulty, and we look again across studies that have been published. About a third have normal cognition, perhaps surprisingly when you look at complex epilepsy practice, but there's also 2/3 with problems of varying degree. The problem we have is there's very little in the literature about careful delineation of both the cognitive issues and the behaviour issues, and very little in the way of longitudinal data. It is all cross-sectional data. So what we need to do is examine this in much more detail, look at children longitudinally, look at the correlates with the specific phenotype, look at the risk factors, because we want to be able to determine early those children at risk for this, to determine the best way of moving forward in management. I think it's important to point out that although behaviour difficulties are seen more commonly in children with cognitive difficulties, cognitively normal children may also have behaviour difficulties. The kinds of problems we see from a behaviour point of view are attention deficit, obsessive compulsive disorder, aggressive outbursts, and anxiety attacks, or anxiety. And as I've pointed out, the issue is specifically aggression and rage attacks, which may be very unpredictable, are not necessarily associated with seizures, and therefore can be quite difficult to manage. There's no doubt that children who have complex epilepsy, for a variety of different reasons, not necessarily just for hypothalamic hamartoma, but specifically because we know they're high at risk, they should undergo a neuropsychological evaluation as part of their assessment. And very specific cognitive issues then can be highlighted and advice given for intervention within the school, namely the kind of practice that's required in the school to optimise their academic performance. And then probably needs review on a regular basis to know whether there's any change over time, because that's going to implicate what we do for further management and how aggressive we have to be with management. With behaviour, there's no doubt that if, again, we look across the epilepsies, there has been a paucity of data about interventions, but we also know there are interventions that are evidence-based that can be effective. And there's been a sort of a reluctance to implement them in conditions where there's an organic cause for the behaviour issue, because they won't work. Well, we have no idea. So there is no reason why, after a careful assessment of the issues involved, the types of behaviours should be treated any differently from behavioural intervention, or indeed some medication where required, any differently to any other behaviour result of anything else. So we need to look at that. We need to look at the standard interventions that we know about, help families, and that will depend also on the individual circumstances of the families. There's no doubt these children have behaviours the result of their disorder, but how they manifest and how much of a problem they may be may also be affected by their circumstance, their ability in school, their achievements in school, their relationships with others. And that needs a careful assessment on an individual basis to know the most appropriate interventions. At Great Ormond Street Hospital, which is the hospital where I work. It's a hospital for children, and we have a complex epilepsy unit within our neurology unit. So we see many children who, if not exclusively children, who have continued to have seizures despite medication. That aside, there are some rare forms of epilepsy that we would expect early referral as soon as there has been diagnosis. When they're referred, they would come into our program, they get seen by the paediatric neurologist. But if we confirm a diagnosis of hypothalamic hamartoma through obviously imaging, magnetic resonance imaging, then we would ensure that they had a neuropsychological assessment and an endocrine assessment at the outset. And then dependent on the presentation, we would be arranging for regular review and serial neuropsychological evaluation over time. It's likely they would also undergo an evaluation with our neuropsychiatrist, and if there are any need for intervention, that would be arranged, but also that may be referral on an intermittent basis depending on the natural history in that particular child. But what we also do is continue care on a shared cared basis with a local paediatrician, because the services in the UK are such that that's necessary, as their local paediatrician will be their first port of call in an emergency. I'm also affiliated with Young Epilepsy, which is a charity for children and young people with epilepsy that also has a centre and school as well as further education college based in Lingfield in Surrey. There has been a centre there for over 100 years, but what there is now is, as I've said, a residential school and further education unit which specialises in children and young people with epilepsy. And then we have a medical and research facility where we have EEG, nursing, medical facility, where we also undertake research that supports the school and further education college. There is no doubt that HH is a rare condition, and they will feel very much on their own. And what's also difficult is to know what's going to happen in the future, as we don't know what sorts of evolution will happen in the progress of the epilepsy. But where they may gain support is contact with other families that have undergone the same thing, parental support organisation where they can gain information. And we should very much work in parallel or in tangent with those individuals to make sure we give the best support to our families.